Approach to Neck Pain NAC OSCE by Dr. Monica Modi. This video is for educational purposes only. This is clinical scenario. 65-year-old male patient presented with neck pain for 1 month. Take focus history and perform physical examination. Before entering the room, you have 2 minutes to read scenario and write your differential diagnosis according to the patient's age, gender and duration of the symptoms. In next 8 minutes, you have to take patient history and perform physical examinations. After entering the room, you introduce yourself and greet the patient. Throughout interview, you should be empathetic, non-judgmental and patient-centered. And don't forget, try to ask open-ended questions. Differential diagnosis of neck pain could be localized causes or systemic causes. Localized causes include musculoskeletal causes, trauma and age-related, or radiculopathy and myelopathy. Systemic causes include infection or chronic diseases such as diabetes, Down syndrome, rheumatoid arthritis, and long-term medication use. Comorbid conditions and patient factor associated with neck pain. So if patient is more than 50 years of age, pathology could be degenerative changes that can lead to myelopathy. If the patient has a history of chronic inflammation, Marfan syndrome and rheumatoid arthritis, pathology could be frailty fracture. If the patient has a history of diabetes, IV drug use, kidney failure, liver failure and long-term steroid use, pathology could be infection. If the patient has a history of malignancy or malignancy in the past, pathology could be spinal metastasis versus primary malignancy. And if the patient has a history of trauma in the past, pathology could be bony and ligament disruptions. If the patient has a history of trisomy 21, pathology could be subluxation from atlantoaxial ligament. History of present illness. So patient has a history of neck pain. So that includes OCD, PQRST, UVW plus 3A. OCD stands for origin, course and durations. And P for position, Q for quality of the pain, R for radiation, S for severity, T for timing, U for does it change with your daily activities, V for has it happened before, W for what has worked for you so far, and 3A includes aggravating factor, elevating factor and associated symptoms. And don't forget to ask open-ended questions. In the history, you should rule out any red flags. So that includes any history of fever, recent history of weight loss, any history of lumps and bumps in patient's body, and past medical history. You can use the mnemonic that is called PAMFOS. So that include past medical history, allergic to any medications, do you take any prescribed medications, family history, any disease that runs in your family, obstetric history in case of the female patients, and social history. Again, you can use another mnemonic. It is called SADOFER, that stands for smoking, alcohol and drug history, over-the-counter medications, food and exercise, relationship and work history. Physical examination include vital signs of the patients and general condition of the patients. Localized examination, inspections that check for swelling, erythema, atrophy, deformity and scars, and curvature of the spine and Valsalva maneuver. In palpation, check for temperature, tenderness, thyroid and lymph node examination. After that, check for range of movement, check for flexion, extension, rotation and lateral flexion of neck. After that, check for muscle power, test against resistance, that will check for muscle power. Special tests include Spurling test, upper limb examination, and neurological examination that include motor examination, sensory examination, and reflexes. And don't forget to check for radial pulse. Investigations include complete blood count, fasting sugar, glycosylated hemoglobin, anti-CCP, urea, creatinine, alanine aminotransferase and alkaline phosphatase, X-ray of cervical spine, and MRI or CT scan if it is indicated. So how do you manage these patients? So management depends on the cause of the conditions. So in our patients, top differential diagnosis could be osteoarthritis, radiculopathy, myelopathy, and malignancy. So according to that, we can manage the patients. Thank you. All the best for NAC OSCE.